So to understand cervical cancer, probably we'll break it down into cervical and cancer. So the cervix is part of the woman's reproductive tract. It's the lowermost part of the uterus, and probably you can also picture it as the uppermost part of your vagina, also called the neck of the womb or shingo ya uzazi. So that's the cervix. It's part of the uterus, the lowermost part. And cancer refers to the uncontrolled growth of abnormal cells. You can get cancer of any part of your body, and today we'll be focusing on cancer of the cervix, so cervical cancer. Well, the causes of cancer are multifactorial, caused by many different things, and most of the time a combination of things. So one, family history of cancer predisposes you to cancer depending on the type of cancer that you have. And then there's what are called environmental exposure or environmental factors. So things that you're exposed to from the outside. For example, in lung cancer, then smoking is an environmental factor. Specifically for cervical cancer, it is closely linked to a virus called HPV. HPV refers to human papilloma virus. More than 90% of women with cervical cancer are also found to have HPV. So you may ask, what is HPV? So HPV is a virus which is a sexually transmitted infection. So the risk factors there would be if you have early sexual debut, you start engaging in sexual intercourse early when you're still young. If you have multiple sexual partners, if you have high-risk sexual contacts, like your partner has multiple partners, or you engage in intercourse with commercial sex workers, for example. Another big risk factor for cervical cancer is HIV. So HIV reduces your immunity and reduces your ability to fight off infections. So an infection that the body could have cleared if the immune system was good, if you're HIV positive and it's not well controlled, then that's a big risk factor for that. Another big risk factor for cervical cancer is other sexually transmitted infections. So for example, if you have any infections that cause ulcers around your genitalia, then you're more predisposed to catching an infection as opposed to somebody who has no infections around that area. So in a nutshell, I would say those are the major risk factors for developing cancer of the cervix. So on the topic of prevention of HPV or prevention of cervical cancer, then, top on that list is, as you mentioned, vaccinations. So vaccination is medication or a compound that we give you before you develop the infection to try and prevent you from getting it. So just like polio vaccine, for example, we give you polio vaccine so that you don't go on to develop polio if you're exposed to it. So it's like a pre-exposure prevention or prophylaxis, so to speak. So we'll look at the risk factors and we'll look at how do we prevent ourselves from being exposed to HPV in the first place. So as I said, so safe sexual practices is big on the list. If you're sexually active, then we would advise on use of barrier methods like condoms, so that would reduce the risk. We would advise on not having many sexual partners, so monogamy comes big there. We would advise you on your frequent checkups. So even before, cancer is a continuum. It doesn't happen at once, like you just develop malaria and you have the symptoms immediately. So before your cells even become abnormal, become cancerous, they first change. They change the shape, they change the size, they change how they look. So they start becoming abnormal slowly. And then there are different grades, from very normal cells to abnormal cells to cancerous cells. So when we do your yearly checkups, what's called a pap smear, where we take a few small cells from the cervix and test, we look at them under the microscope and we can see these cells are not looking normal. If we don't do anything about it, in the next 5 or 10 years, this lady may develop cervical cancer. So we're able to pick it up very early if you do your checkups. I think a big disservice we do ourselves in this continent especially, is we present very late. So somebody may have had lots of symptoms before they've been, maybe about a year or 2 years. By the time they come, maybe they're in stage 3 or stage 4 of cancer. And at some of those stages, probably it would just be palliative treatment. We can't cure it, as opposed to if it's picked up very early. So safe sexual practices, not having multiple sexual partners, having your regular medical checkups with your gynecologist, very important.